I'd like to take the opportunity to introduce our moderator first and foremost, and then I'll let you know who here is on the panel. So most of you may know David Kochman. He's our moderator. David's not only a lawyer, but Chief Corporate Affairs at Henry Schein. David sits across the entire, really multiple areas of the business. He's a trusted internal key stakeholder. He meets clearly the VIP standards we have here today and has developed so many relationships internally as well as externally in the industry. He, in addition to that, is somebody who can always keep me in check in terms of ever winning a race that I run. He's a talented and very established runner. So I appreciate that from David as well. Our panelists are going to be Ali Shazib. He is the dean at the High Point University Workman School of Dental Medicine. I work with him on the board and see the wonderful things the school is doing in terms of educating new learners. In addition to him and sitting next to him, we have Nader, who's Senior VP of Education Professional Affairs at the ADA. Next to him is Dr. Arwinder Judge, and he is the Chief Clinical Officer at the Aspen Group. We have Carol Ann, who is the Dean at Indiana University. And last but certainly not least is Andrew Smith, the CEO of the ADSO, American Dental Association for DSOs. Thank you.
Thanks for the kind introduction. Appreciate as well the warm weather for good running out here. Good morning, everyone. Great to see you. Great to see so many friendly faces. I want to thank Marty, Jeremy, and Craig for putting on a terrific event. We have a fantastic panel here to cover a really scintillating topic, and I don't say that with any hyperbole. You know, the industry and the profession are evolving rapidly. They're being shaped by patient expectations, reimbursement pressures, consolidation, technology and innovation, and consumer-driven care. The dentist and the dental team's role are radically changing and evolving. Converging at these crossroads are academia and private commercial enterprise, which includes both the providers and industry. So some of the questions we're going to explore are, to what extent should the future of dental innovation and technology and practice be driven by academic research or private enterprise? What if one wants to move faster? Who gets to control the speed? Will the dentist of the future be more of a clinician, a technologist, or a healthcare leader? And what's the appropriate roles of educators and employers in all of this? We've got a great panel to dig in with this. So why don't we start, and I'm going to start with our academics who are probably a little bit more versed in the Socratic method than others. So Carol Ann and Ali, and Carol Ann, I'll start with you. You know, dental education has always balanced science, theory, clinical competency, but the real-world practice environment itself is changing. Critics would argue that dental education is outdated, maybe a bit too slow and disconnected from the real world of practice. So are dental schools keeping pace with the realities of modern dentistry, or are they unintentionally holding graduates back? And I guess I'd ask you as well to maybe shape in with that, what does the dentist of the future look like?
Great, thank you. That's a lot. Well, first to start, we're dealing with a very complex environment and a lot of change outside. But our first job at dental schools is to graduate competent beginning dentists. And we accept students who come in all with the different sets of talents, the trajectory by which they achieve competency, their motivation, doing less dentistry, more balance in life. I hear that all the time. And preparing them for a whole myriad of possibilities of where their practice is going to be. Some may not actually practice a lot. They may go into different roles in the dental industry. And so the job for dental schools is to prepare a diverse group of students for diverse opportunities at the end, and we have to deliver the very basics that they are competent to practice dentistry independently as a safe beginner. So, yes, we are holding them back. We have to balance patient safety with that educational objective, and so I think that it's a big job.
And you think that the dental schools right now are set up from an infrastructure standpoint to be able to do that?
You know one dental school, you know one dental school. Some are better at it than others. Some have other strengths. But I do say, from where I sit, having been at 3 different dental schools, it is a constant challenge. Resources are a challenge, and we may not be well positioned to meet the future, but we need to change. And so we know we can change. During the pandemic, we had to change. We didn't like it, but we can do it. We need to continue to have that sense of urgency to change.
Yeah, that necessity of evolution is, I think, something commonly shared between academia and private enterprise as well. Ali, let me ask you, as the dean of a newer dental school itself, what do you think about Carol Ann's answer? And let me maybe ask you as well to build in, what do people get wrong about dental education?
I have to echo Carol Ann that it's very complex when you're managing a school that's got institutional history and a lot of different procedures that are in place. We don't by any means dismiss the fact that we are building a brand new school, so we were privileged to be able to ask thousands and thousands of people across healthcare systems, across industries that are para-related, of what does a graduate dentist look like. So from the perspective of being a brand new school that's going to graduate its first class in 2028, we are very closely looking at the market. And what the market means is we're going to have more patients with chronic conditions than ever. We're going to have a lot more cancer survivors than we ever had. And so the baseline of what a graduate dentist needs to be will have to be tailored according to where the market is going. We also have a convergence in care where the practice networks are becoming more integrated. Some may say value-based, some may say practice-oriented. But at the end of the day, our clinicians of the future, we believe through our model, could be advocates, researchers, and entrepreneurs. And so there is a heterogeneity in what our curriculums need to be prepared for, so that we're not producing just one type of healthcare leader, but one that's broad-minded and then be able to thrive in the launch board or springboard or whatever environment they go into. And that balance is where every school has variability.
Thank you. So Arwinder, let me come to you, because defenders are going to say, just as we heard, that dental schools exist to protect clinical rigor, not chase trends. So sitting inside in the chief clinical officer where you do, are there skills that you see as being underdeveloped during the dental school journey? Business, leadership, technology, speed of treatment?
These guys are terrible. No, I'm just kidding. I'm kidding. Listen, I don't envy the role that the deans have. I mean, there's a lot that they have to, you're fundraising, you got a lot of things going on. And the dental students, when you think about it, my son's a second-year dental student. He asked me to ask all of you to make the sciences a little easier for him, But there's, when you think about what they have to teach them from a clinical development standpoint, they have to be artists, they have to be scientists, they got to use their hands. There's just a lot to do in 4 years. And then you have a ton of technology and innovation. And the team here was talking about how much change we've had in 5 years. It's a lot to keep up with. Do we have to augment a lot of these skills? Yes. The answer is yes. It's gotten to be more and more since COVID hit. And the things that we are continually, and it's probably a competitive advantage for us, we've built out a university around this. We are improving skills related to treatment presentation, soft skills around case presentation, acceptance, and then really the basic blocking and tackling stuff too, as well as from extraction academies, all the way up towards implant placement, surgical placement. So we have 3 legs to the tool, I would say: clinical development, business development, leadership development, and now we've got an innovation and technology element as well. So those are the things that we have to develop. We don't expect the schools to be great on the business and leadership standpoint. I think where we could probably use some help is probably on the basic blocking and tackling skills. However, and I'll be very short here, there's variability. It's a bell curve for dental schools as well. And I've got to tell you, you've got great dental students coming out. You were in a school that had great dental schools. We'll have to see what you do, but I'm sure you'll be great. I've known him for a long time. But it is a bell curve out there, and so there is a ton of variability.
Well, and so where you sit, just to put you a little bit of pressure here, friendly pressure, right? You're sitting within a model itself that has emerged really over the past 30 years to be a pretty powerful force within the dental profession, representing 17 to 30% depending how you define a DSO. So are DSOs strengthening the profession by improving access and efficiency, or are they changing dentistry in ways that we may ultimately regret, such as risking undermining autonomy and clinical identity?
Yeah, no, thanks for asking that question. When it comes to access to care, I've got to tell you, I'll go back a little bit. When we were opening up offices in Maine, we had a struggle. When we opened up offices in North Carolina, the people here, Andrew knows this pretty well, the struggle that we had with entrenched interests and stuff. When I opened up an office back up in Bangor, Maine, we had over 700 people lined up to get through the doors. Now, you would think that the dental societies, the dental boards, the regulators would say, hey, come in so you can develop it, because nobody graduates dental school, very few do, and say, I want to plant my flag in Bangor, Maine, or Flint, Michigan, or great cities, by the way. But none of them are developing. They're not coming out saying, these are the things, these are the places I want to go. So and our model was developed in the rural markets. And so anytime we'd open up an office, with very little marketing, you'd have a lot of people lined up. The clinical autonomy question for me, it's pretty straightforward and simple. There's nobody telling the doctors what to do. It's their treatment plan. It's their patients. So for me, that's kind of long gone from the clinical autonomy standpoint. I mean, yeah.
So thank you for that. Let me go over to Andrew, and I'll give you, seeing as you're the CEO of the ADSO itself, maybe I won't put you on the specific spot of Arwinder speaking on behalf of TAG, but same question over to you, and maybe you could bring in a little bit of, what might we lose if we don't embrace more of the DSO model?
Yeah, no, thank you, David. So I'm going to answer the question, but just very, very quick so people know ADSO, we're the trade association that represents DSOs. We've got about 80 members representing about $18 billion in revenue. I think we have our members account for 15,000 dentists, 7,500 practice locations, and ADSO started initially as a opportunity with many of the leading DSOs getting together to talk about best practices. And they were all very regionally based and kind of looking at, how are you doing this? How should we look at this? Are you having trouble with that? It all started with that. And then it began when there were some regulatory threats. And I think like any other industry that's growing, that is disrupting, is going to rub some feathers the wrong way. I kind of equated a little about when you think maybe 10, 15 years ago when Uber hit the scene and there were a lot of concerns between the Taxi Cab Association and Uber. Now, when you look at it, Uber created a lot of great access for more people who didn't have traditional availability to transportation and made it kind of more of a democratization. So what I would argue, especially when you look at DSOs and the nature of students coming out of dental school today, about 40% who graduate go into a dental support organization. And why is that? Well, in some instances, and this is not the dean's obviously fault up here, but the cost of dental education has increased significantly. Most dental students come out today with about $350,000 of debt. And the historical model of when you would come out, be an associate doctor, work for an owner doc, and then buy them out, that's continuing to be more and more difficult to do. And so I think also this generation has a different value of work-life balance. And I think that's what a DSO affords, is that there are some folks that want to come in and just do the clinical side and not have to do the business side. Then there are some who are entrepreneurial and want to get into that and do all that, and that's an opportunity. And I think the other piece that Dr. Judge was mentioning, and I think the deans can mention this too, their job in dental school is to clinical, right, and not practice management, and a lot of these young grads are not super comfortable with how do I get in and how do I learn. So I think what you would look to lose, to your original question, is there is now an access to care issue. As we all know in this room, not enough Americans go see a dentist. When you look at dental shortage areas across the country, huge, huge swaths of that. And we've worked with the American Dental Association, the American Dental Hygiene Association on licensure portability. So making it easier for the workforce to go where there is care. And I think what the role of DSOs are playing is increasing that access. Many DSOs take quite a bit of insurance, right? So there's a more appetite to get into care. In many instances, there's opportunities to finance care where people have trouble doing that. You know, my parents are 75, 78, and my mom actually had to have a tooth extracted, and she called me as if I think she thinks I'm a dentist now for some reason when I'm not. But she was just said, I can't believe it's going to cost $1,500. Why doesn't dental insurance cover that? That's a whole other topic. But the point is, there are options and needs that the DSOs are filling in where the nature of the practice of dentistry is going, and what not only the patients expect in terms of being able to make appointments, being able to get into care more frequent times, but also what the new generation of clinicians want. So I think you'd be losing a lot of those aspects if it wasn't there. Sorry for the long answer, but wanted to set the tone.
It's a great answer, and I'm going to come back to both of you, but let me set up Nader a bit, because you've had the privilege of both just being a dean at U of P and now being in your role at ADA. And I'm going to layer on another factoid, right, which we've seen that there's been at least proposals that have been put forward that seek to change the model or at least prohibit certain models of DSOs. And the underlying argument there is that there is a rush for profits itself, and that is itself undercutting kind of patient safety. So I guess I'd ask you, what's the case to be a solo dentist? Is that still possible right now? And what worries you, if anything, about the DSO model?
Yeah, thank you for setting me up, Dave. Yeah, there's a lot here, and I appreciate some of the comments. The way that the profession is evolving and the practice models are evolving, in any other industry that you look at, it's the same here. There will always be a case for the solo practice and the smaller groups, and there will always be a case for the DSOs. And when you're looking at access to care issues, when you're looking at the quality of the care that's delivered, you need that diversity in the model. So there will always be room for these different models. The question is, how are we moving that forward? And what we're hearing here on stage is there's a lot of interest in looking for efficiencies while you're maintaining quality, and that's the same in a private practice as it would be in a DSO, or it might be if you're working in a federally qualified health center or at the VA, or any of the delivery models that are out there. So from kind of my perspective, that having been a dean, we're preparing graduates to be successful in practice, depending on whatever practice model they choose. And from the organizational perspective where I sit now, the ADA's mission is to help dentists succeed. And their role is also to help advance the health of the public. And you can't do that with just one model. You have to do that across the board, looking at all of the providers that are there. So it's really, there's all the comments we're hearing here, there's so much more commonality that we can work together on in the message and how we go out into the public, how we advocate for access. So, and as we're hearing, even, as you were mentioning, the autonomy of the practitioner is there. Everybody wants the same thing. The integrity of the work that's done, the ethics of the profession, those remain consistent in all of these models, and there isn't one that's going to be better at it than the other.
Thank you. Ali, I guess sitting where you do inside of the dental school, are these some of the dynamics you hear or feel, or is there an inexorable drive to folks saying this dental school costs so much, it's really difficult for me, I want to start out, I want to be in a DSO because that is kind of the shortest putt for my career?
And if I can make one additional comment in the attempt to answer your question, I do think the generalization that one school is the way every school is fairly naive to make. So I'll give you a snapshot of what our model is structured based on. And so we, as a school, as a nonprofit academic university, are acquiring practices and building a network of practices. So that is the authentic practice environment where students in their first year are getting the exposure to the business of dentistry. I think Dr. Judge mentioned that they need business training, business acumen. So we expose them in that environment. And then as they graduate into their advanced years, they're spending more time as clinical providers. They're learning what rooming is, handoff is, what is it to look at a P&L of a practice, what's break-even analysis, and so forth. The notion of doing that is that they are immersed into a practice environment where there is an emphasis on efficiency, on the multitasking that a healthcare provider needs to do, on also the behavioral cues on how to manage your team and how to be a leader and how to be an advocate. And then 20% of their time is spent in healthcare settings like FQHCs and other sites, which most schools do. They have externships and enrichment programs there.
The hope we have is that I think, and this is based on the way we look at the Flexner report and the way medical education has evolved, we will have more models in the next decade or two where academic health centers will be merging the efficiencies of DSOs and the impact on care with the academic enrichment and structure. And we will see more of the Mayo clinics that are very distributed in the state and nationwide, where there will be another model of practice. So it's not, maybe not deans versus DSO, it maybe is a third making in the evolution of where we are.
Well, that's a perfect transition because we've surfaced maybe some inherent or underlying tensions, but maybe let's move to collaboration. And Caroline, let me ask you, is the divide between dental schools and DSOs, is it rooted in ideology, economics, mistrust, or just the necessary evolution of models? And what would meaningful collaboration between DSOs and dental schools look like?
Thanks. I do think it starts with mistrust, and I think it goes back historical narratives about what DSOs were and what they are and how they're different from private practice. And I also think that every dental school has to live in their own local environment, their alumni base. It all colors that picture. But I also see lots of opportunity for collaboration. And one in particular, there's different dental school models. Ali's sounds like a really exciting one, and I think you're onto something. My school is a little more traditional. We have already invested in facilities, a traditional dental school building, et cetera. But ways we can collaborate include the senior year when we place our dental students out in the community in FQHCs, public health, and private practices. DSOs are another logical opportunity for students to go in and gain more clinical experience, be exposed to that model, and help them decide what kind of practice is going to be best for them as they graduate. We can also collaborate on, and I'm so glad you mentioned it, I've talked to Nader about this. Dental school clinics used to be just there to support learning, but more and more we have to run things efficiently. We're dependent on it not to be a drain on our finances, but the potential opportunity to support the education mission. I'm eager to learn how I can do that better by collaborating with others who figured it out, and again, hearing about the technology that's available today, lots of opportunity for us to collaborate in that way. So those are two ways that I can think of immediately about ways we could collaborate, dental education and DSOs.
Thank you for that. Arwinder, I guess what's your perspective? Or do you see those as opportunities or maybe something different or additional?
Well, I think there's opportunities all the time, but I think the collaboration has increased over the last few years. I think Andrew's done a nice job through the ADSO, bringing in the deans there. I think the deans are actually extremely open. I mean, they don't see a problem with the DSO world, and you said it. You have faculty that's mostly private practice, and a lot of them just don't understand what a DSO is still. They hear things and they're like, oh my God, Aspen Dental, or I don't know any other DSOs. So Aspen Dental. Okay, so, but now you're seeing more and more faculty coming from the DSO world. And so you do, when I said it was hard for the deans, it is difficult because you have an alumni association you're trying to protect. The ADA is going through some of the same struggles, unfortunately, as they're trying to figure things out and try to keep the base happy, but they see where the world's going and they're like, well, we don't want to go the way of the AMA as we're kind of working through this. But I think, listen, we were doing it. We are placing students in their senior years within our offices, so we're doing quite a bit of that already. I think we should collaborate more. Many deans have asked me to kind of come in, take a look at their curriculums, work with them, see how we can improve upon that so they can build the dentist of the future. So we're working with deans to do those kinds of things already.
Thanks. Andrew and then Nader, what is your association doing to help support or augment this type of collaboration? And what's the future, I guess, that you're fighting for?
Yeah, no, great question. So one of the things that we continue to do is we've mentioned clinical rotations. We partner with groups that help facilitate that among our members and schools, and I think that's a critical component for them to get the on-hands practice training. We've also been very engaged on going to dental schools and speaking directly to dental students and really just talking about what a DSO isn't answering questions, keeping that connectivity. We're also very, very involved with the American Student Dental Association. And what we've done there is to also kind of educate, talk about things, but we've also have sponsored and brought in a lot of our technology partners that support the DSOs. And it's interesting when you see the dental students, they're very, very more interested in looking at that. Implants, salivary testing, AI, you name it, they're very, very interested in it. And so I think it's kind of just showcasing, the opportunities and aspects that they should expect in a modern practice, whether it's a DSO or solo practice. I think where I'm looking at, kind of the future and where it's going, as I mentioned, 40% of dental grads are going to a DSO. We have some data, showcasing that about 50 to 51% of patients now go to a DSO. And, I think when you look, through claims data, private insurance, Fluent, I'm sure people are aware of. In most instances, when you look at the, claim information, the level of retreatment rates is lower among DSOs, patient satisfaction is lower among DSOs, and there's more dentistry being diagnosed. Now, we can have that argument on whether or not that's good or bad, but I do think with the use of technology and those efficiencies, they're putting it into the patient's hand. And I think we've had a conversation about artificial intelligence and how they're looking at that. But I think there's a world where we're seeing, there's always going to be multi-models of practice of dentistry. And I think that's an area that we're starting to see more and more of, but I think the DSOs are going to be, an integral part in that world.
Thanks. Nader, same question, but if you could build in a little bit of, with respect to the collaboration, who owns and who can help with respect to the workforce shortages and the burnout that we're increasingly seeing?
Yeah, the system that we're in, it also includes the American Dental Education Association. So they're the organization that the schools and all the programs, whether it's allied, dental, or advanced programs, are members of. So it's partnering on our side with the practicing profession. So whether it's the DSOs or the private practices, bringing in a DIA's perspective and then looking at where we can make those improvements. There was a lot of great examples about opportunities that are there. The additional bits are for the schools to have more intelligence when one of their graduates is out in practice 3 years. How are they doing? Where could they have been better trained? That is valuable for schools to continue to evolve their curriculum. There's a lot there. The industry partnerships of making sure that the latest technology and equipment are available to the schools as they're training, because then the students are going to go out, whether they're in a DSO or another model, be able to practice with that. So I think there's a lot there. You added something, and
The burnout piece, but I think you built that into your response there.
Yeah, the burnout piece goes all the way back to school, because schools are looking at faculty and their teams and burnout issues, and then the students that are coming in, making sure wellness is important for them, and then as a professional association, making sure that extends and there's resources to practitioners, because there's a lot of pressure in terms of being the primary provider for someone, and that pressure needs to be managed, and we have to make sure the right tools are available for practitioners. Again, regardless of the delivery model that they're in, DSOs may have some resources that a private practice wouldn't have. We just need to make sure everybody has access to those resources.
Thanks. So very quickly, I'm going to give you guys, we'll do a quick lightning round. I posed a question initially, which is, will the dentist of the future be more a clinician, a technologist, or a healthcare leader? And is the profession ready for that? And I'm going to start with you, Ali, and then just go down. Quick response.
Clinician, advocate, research, entrepreneur, all in equal parts. That is the dentist of 2030.
Healthcare leader.
All of the above. I'd say healthcare leader, clinician, entrepreneur, yeah.
I hope clinician and healthcare leader, absolutely, and whatever else they want to do.
I have nothing else to add. I agree wholeheartedly on everything else.
I have nothing else to add as well, except to offer you to please give a thank you to our phenomenal panel. And with that, I'm going to turn it back over to Jeremy.